Our next speaker was supposed to be, well, it is Dr. Peter Cruse, but unfortunately he couldn't be here. He actually sent us a recording of his talk. So we're going to watch a little video, have a little bit of cinema time here. And then Joey and I, who know Dr. Peter Cruse and his topic quite well, will field any questions if there are any. And it's quite actually timely that his talk is after mine because he is going to be talking about AI. So who is Peter? He is a former medical Rhodes scholar to Oxford University, former Groote Hospital chief specialist, UCT professor of anatomical pathology, and UCT GSP MBA gold medalist. He is a very experienced hospital CEO, CMO, and commercial manager of multi-site hospitals, clinics, and medical laboratories. So Peter's talk is going to be on using AI to promote your private practice, footfall, and revenues. And so just bearing in mind some excellent tips, but then you apply that through the lens of the ethical considerations. Thank you so much.
Good morning. Today we're going to discuss how to revolutionize your general practice by using artificial intelligence. Now, in today's fast-moving healthcare environment, artificial intelligence is no longer a futuristic concept. It's here and it's transforming how we deliver healthcare and also how we manage our daily medical practices. By embracing AI, GPs and other clinicians can enhance patient outcomes, can streamline their own operations and stay ahead in an increasingly competitive market. Three important points to start before we look at the slides in the presentation. First of all, AI is here to stay. It's not going to go away. So you do need to get used to it and understand how to work with it. Secondly, we need to understand AI and how to use it for the benefit of our patients and also for our practices. And then just to reassure you that the only doctors who are not going to be replaced by AI are the ones who do not use AI. So if you use AI, it's likely you'll keep up and then you will not become redundant because you know what's going on. Now, this presentation will briefly explore how AI can be harnessed to improve clinical efficiency, business strategies, and specifically marketing. And just to guide you to the presentation, we've prepared a lot of information together with case studies on every slide. And the idea is that you obtain a copy from Joey later, that you do some self-study, and that you check on the links in the case studies in order to follow up. Also, we're not going to endorse any particular products. If we do mention a particular chatbot or software, it's not that we are endorsing it, we're just giving it as an example. So the presentation will show you a little bit about streamlining admin tasks, but it doesn't stop there because AI can actually help you grow your practice footfall and also increase your practice revenue, which is obviously one of the parameters that you will use to measure your success. AI-assisted marketing is therefore the focus of this presentation, and you will have access to the presentation and the references for future study. I also need to stress that AI was used in the making of these slides and, of course, in the content. And I'm not saying that I'm not responsible for it, but there is one glitch which I'll explain to you. And the AI, particularly generative AI, is not perfect. It will make mistakes. And you are always, as the clinician, responsible for anything that your practice does using AI. You must always check, use clinical judgment, check references, etc. So we're going to delve into some practical tips to see how you can use AI driven chatbots and other tools to manage your appointments. And I'll give you an example. You need to have software that will help you answer patient inquiries. This means you don't have to employ full-time receptionists to answer the telephone because people are making bookings online. The chatbot is showing them your diary and basically placing them at a time and place that suits you, and also giving them the option of a virtual appointment. We'll also cover how social media marketing can increase your practice visibility and enable you to attract new patients. And we'll explore how it can help you optimize your patients' operations to maximize your profit, and then you can invest in your practice to improve the patient experience and also clinical outcomes. So join us as we explore these strategies for increasing the quality of care and the success of your practice by using modern technology and embracing it rather than running away from it. Okay, so just very quickly, I'm a retired medical practitioner. I did 5 years of general practice in London, where I started a medical practice which is still going 35 years later. And although I ended up becoming a professor of pathology, I do understand a bit about the business side of medicine, which is what we're trying to help you with here. Part of Take Note's mission is to empower you, to give you the knowledge you need to navigate in the face of quite a difficult market and ecosystem. And it'll help you to understand and to feel more empowered as you take on medical aids and negotiate tariffs and do all of these sorts of things. So the contents briefly, and we're not going to read every word on every slide because that will take us too long. The first and most important point is you need to understand your patient audience. Not all general practices are the same. Some specialize in adolescent or young patients. Others specialize in older patients. Some are focused on diabetic care. Some have chronic diseases like kidney disease. Still others are focused on occupational health or gynae. And you need to target your marketing to suit that audience. And you need to use Google Analytics and other methods to see where your patients are coming from and how they find you. So using the power of AI, you can understand where your marketing is coming from. You can enhance your patient engagement experience using chatbots, for example, which are very user-friendly and not threatening. People can do them in their own time. One of them is, for example, practice appointment booking. You can implement customer relations management, CRM systems. I checked on Google this morning. There are at least 10 systems available in South Africa. One costs 400 and something rand a month, and most are free. You can leverage social media, Instagram, Facebook, LinkedIn, etc., to enable you to market your services to patients. You need to think a bit about offering incentives and loyalty programs within the guidance of the HPC SA. You can reward people, for example, by charging lower fees where they use the digital side of your practice or take virtual consultations or book themselves rather than booking through the telephone and the usual methods. You do need to monitor and optimize how this marketing effect is going. You're used to monitoring patients by taking blood samples and measuring. In the same way, you need to monitor the attendance at your practice, the segmentation of where those patients come from, their age distribution, their demographics, and then tailor the marketing messages so that they differ for different subpopulations. While doing all this, we always need to be aware of compliance and ethics. Likewise, now that we're using and encouraging you to use AI, you do need to aware, and I highlight specific dangers and pitfalls, some of which I've encountered myself. And then we can give you a quick summary of what the most commonly used and readily available free AI service, ChatGPT, can do for you and your medical practice. And then we'll draw some conclusions. Now, understanding your target patient audience, we've alluded to, using free Google Analytics and other software, you can analyze where the market that you operate in, where your patients come from. So if you have 10,000 patients on the books, for example, or 5,000, you need to know roughly what their age and demographics is. If you've never done this before, and I'm not endorsing this, you need to know that big insurers like Discovery, Momentum, and others know more about your medical practice than you do. If you sign on with them, you can see a dashboard of your own practice, and they will tell you roughly, or indeed in great detail, where your practices, where your patients come from, what their age distribution, what their disease distribution is, the commonest codes and billing, and a whole lot of other information that you do need to know and measure. If you don't measure things, and that means marketing too, then things don't get done. And by segmenting and focusing your marketing on specific subgroups. So here's a case study, which is listed again in the references that shows you a little bit how to do this. The same, and this is AI again repeating this wording, but with different phrases to show that you need to optimize your performance in real time by seeing which part of your sales and marketing effort, whether through social media, whether it's the customer relations software, whether it is word of mouth, or other forms of recommendation or endorsement, where they come from, and then you focus on them. Another case study. At the end of each slide, there is a recommended case study. By the way, none of these case studies, or very few, come from South Africa, because we've not yet used AI to the extent where publications and research are being done in any great extent. But many of the lessons from overseas are applicable. So chatbots, for example, are automatic systems run through algorithms which enable your patient to engage with aspects of your practice, which could include, and I'll use a name, Recomed, as one of the patient booking systems. The only reason I mention it is that my GP uses it. So when I want to see my GP, I can go online at any time that suits me. I can see my doctor's diary for the week or the month. I can pick a time. I can send him a note saying, look, I don't really need to see you. I need a repeat prescription for chronic meds. Or could you please give me a form for my routine blood tests? Or you were meant to send me for a chest x-ray, for example. So all of these things can be done automatically. On chatbots, you can also have the patient select that they don't want a clinical appointment. They, for example, want to talk to the accountant to check the billing or the status of their accounts and so on. And this information, which is put in through the chatbot system, is then available to you as you try and understand your patient's needs and then engage with them and help them to have a better experience and to get more value from being in your practice. Again, a case study around that point. So customer relations management, CRM software, you can Google it. I did it this morning. There are, as I said, at least 10 software systems available in South Africa. These enable you to specifically look after the sales and marketing side of your practice, totally ethically. It manages the interaction with the patients. There can be standard letters of follow-up, and you can, for example, ask what was the patient experience like? How long did they wait? Were people courteous? All sorts of questions. And you can learn from that with your marketing team and then use that information to follow up with a patient. For example, if there are any complaints or commendations, you know where things are going right or wrong, and then you communicate back with the patient, who are always charmed to receive information from you. Another case study around this point of CRM. Now, general social media, you're all familiar with. The X platform, for example, Instagram, LinkedIn, Facebook. You ought to have a presence, both a website and a presence linked via icons onto all of these social media so people can find you. When you post something, for example, you're starting a new service, a free diabetic checkup, for example, or free, a pap smear or a vaccination, you can use this information to send targeted messages back to people who use these media and have found you on those media. Also, it helps you to study whether your content on the website or Facebook content or Instagram content or LinkedIn, for that matter, is less or more effective than other content. And then you can, if you like, gently push the ones that are working and improve the ones that are not working. And this enables patients to feel more engaged with you. Case study to that point. Something that very few practices think about is offering incentives and loyalty programs. For example, I've been with a particular practice in Cape Town for 30 years, but they've never ever said, well done for 10 years or 15 years or 20 years. It's a very simple thing to set up a diary. When people join the practice, there are practice anniversaries, and then you can thank them legally and totally ethically by saying, look, come in for a free blood pressure check, or hemoglobin A1C check. Thank you very much for that. You can also implement referral programs where when patients contact you, they can name another patient who recommended them, and then you can provide a discount or some other appreciation to the referrer. And the same is true of social media engagement. You can encourage people to use your practice digitally, virtually, rather than physically, because the cost of physical consultations is, of course, much higher than it is if you go virtually. And this is just a way of driving through incentives, patient behavior to benefit lower cost, better care and more personalized care. So practice marketing, therefore, is a big umbrella term which includes sales and so on. Google Analytics will allow you to look at how your website is doing and your other social media and see what the source of the attention is and the interest. For example, you may see that nobody reads your stuff on Facebook, in which case you have to sharpen your pencil, metaphorically, and improve the offering and highlight that. Whereas you may find that people are finding you readily through Instagram or some other method which is working better. So you enhance those that are working well and improve the performance of those social media modalities that are not working well. And so you are actively managing your sales and marketing rather than sitting passively and just waiting for people to find you. Word of mouth is, of course, still the best recommendation, but you can't sit back and rely on it in today's competitive market. I won't politicize this, but you notice that all the big pharmacy retail chains are suddenly offering clinics and consultations at knockdown prices for common screening and other things that you perhaps haven't thought of. And others are muscling in on your market because you need to be proactive. And by using the technology of AI, you put yourself in a better position to compete. And so our mission at Take Note is to help you, to empower you with knowledge to compete better while remaining ethical and attentive to the patient. So it is important while you're doing this and while you're trying to enhance your practice, marketing and sales, and therefore Footfall, you need to be aware of the guidance issued by HPCSA. I won't give you the booklet numbers, but there are specific booklets around telemedicine, virtual consultations, and so on, and about advertising. And you can't disparage your colleagues, and you can't really claim to be better than them. So you have to be cognizant of this and keep within those guidelines. At the same time, you must train your staff on compliance, particularly about patient privacy and data protection under the POPIA Act, and make sure that everything you do, which is AI-driven, is also compliant, because as I'll show you briefly, AI has no moral compass or conscience. It will say and do things which please you, but actually may not be allowed by the regulations. So this is where you are responsible as the practitioner and as the leader and sometimes cheerleader of your practice. And you ought to audit the way that your patients and your systems, including CRM and chatbots, treat your patients to make sure that they are ethical and compliant with regulations from HPC and with the POPIA Act. Now, in my experience of AI, there are many pitfalls, which, of course, you're not told about. So I thought I would tell them about you here. Some of these observations of mine come from personal experience in using it. And it is important to understand that artificial intelligence algorithms are computer-driven. They're not people, although they can seem very human-like. And that AI systems have no conscience, ethics, professional or moral values. So they may say or suggest things that are not entirely in keeping with our professional standards. It doesn't know right from wrong. You need to impose that on anything you do with AI. Also, it's clear that AI has inbuilt prejudices and biases. These relate to the data that it was trained on and the inputs that creators, coders, and programmers gave it. And as I make the last bullet point, much of the data fed into the chatbot app, which was released in 2023, I think, was trained on data from 21 and 22, and now is out of date. So as we move on, hopefully the training will improve, but they may give you out-of-date recommendations, which you need to verify. So when you're using AI, you need to be aware that not be naive, that what's actually happening, it's a commercial program, that you are teaching it free, and it is learning from you, right? Although you get some benefits from it, you must not tell AI your secrets, your patents, or your ideas, because that will be captured and used for the benefit of the AI service company and not necessarily for you or your patient. It's a bit brutal to say it, but I'm afraid that's the truth. AI, to be frank, is a commercial product, and it's designed to make money. And so its algorithms will try to please you with answers that satisfy you, but they may not be correct and they may not be honest. Very important to understand that. Later, when the AI systems feel fully trained, they will be released in much more powerful commercial versions, which you have contributed to educating. So be aware of that you need to understand that you're only a small cog in the wheel, and that your answers and prompts are providing the AI platform with an opportunity to learn. Now, some of the pitfalls and dangers of using it in healthcare that I've found are the AI systems can't read semantically. In other words, they can't search within a website. They might find the reference title or the website, but they're unable to search for keywords inside. So their search capability is very limited. That's an important point. The second point is Geiger. You may remember this from years ago. Garbage in, garbage out. The answers you get by using a generative AI system like ChatGPT is only as good as the prompts that you give it. Now, when I used ChatGPT, for example, to create these slides and the content and to show me the references, I used extensive prompts, approximately a paragraph. So the more high quality prompts, the more rail lines and tram lines and boundaries that you set in your prompting of the AI system that you're using, and there are many, the better quality and the more relevant answer you're likely to get. Do remember that AI will try to please you with fake references or data. I once gave a talk to the psychiatrist in Cape Town, was very pleased with the first draft of the lecture. And then I noticed that all the references were Vermeulen, Du Toit, Mabako, etc., South African sounding. I thought, hang on a second. I couldn't find any PubMed references to AI publications from South Africa. And then I realized that every reference was fake. It had taken some South African sounding names, picked some journals that sounded cool in the AI space, and given me some DOI numbers, which turned out to be fake. So it is important to be mature and guarded and cautious, and it's up to you to check everything. Now, you also need to know, those of you who read your newspapers, that AI's legal responsibility for errors is still to be tested in the courts in our country. There were 2 cases in Cape Town, sadly, where South African tourists from abroad used, I think, Google Maps or similar system to travel to or from the airport, and for some reason were directed wrongly, inappropriately, through Langa Township in one case and another, where they were apprehended by criminals and sadly shot or murdered. And the relatives want to sue Google Maps for sending them through a dangerous area, but those cases have yet to be tested. So it's safe to assume that AI has no responsibility, that you are totally responsible for everything that you output through AI. And you need to protect yourself and your patients and your practice by exerting your clinical and professional judgment at all times. If in doubt, you can contact HPC or any other body, the medical association, for example, and get further advice. So it has no ethical or moral responsibility. And the use to which you put it, whether it's an output, data, references, or so on, is your responsibility, the doctor's responsibility. And this is one of the reasons why it should never replace you, the clinician, in your practice. So there are many uses, for example, to be specific, of ChatGPT in your practice: remote management of patients, using virtual assistants, clinical decision support. You can nowadays, when you're with a patient live, you can ask a quick question about side effects of a particular drug, the interactions between the drugs and lab testing. It can suggest differential diagnoses, suggest treatment options, but these are only suggestions, and your clinical judgment comes first. And this enhances the power of your mind and your training, and allows you to check up on things, and also to verify, and also sometimes to be updated. Your medical record keeping, the EMR, can be used, electronic medical record. Various doctors, and we know several, are using standard referral letters, standard discharge letters, call and recall for follow-up letters, which can be personalized and customized, that are written using templates, which AI has generated for them. And the idea of encouraging you is that you can task shift away from doing each of these in an individual way, in a cumbersome analog way, every time you see a patient. And you can use generic templates and then personalize them to make sure that you basically can work more efficiently. So you can have a greater output of effort. And so other uses include medical translation. I work with some colleagues in the UK who've invented chatbots that I think can translate live 11 different European languages into particularly medical terms. So if a Czechoslovakian patient comes into NHS hospital, nobody there speaks Czech, they don't speak English. They can speak into the phone or the computer. Chatbot will produce English script, and particularly in an emergency, and say, where's the pain or whatever it is, and make a much more safe diagnosis and admission. You can use ChatGPT to develop accurate and reliable symptom checkers, and this gives you more fine-tuning in your clinical practice. It can enhance medical education. Here we are using it. And so ultimately, as a package, it gives users, healthcare professionals and students, access to global medical information, which will support you in your ongoing professional development. So to summarize, you too, even if you know nothing about AI, can use free and powerful AI tools to enhance your practice, provided you download slide presentations such as this one, study online, empower yourself, learn, and then practice and use it to make your life better and easier. AI has great potential to ethically boost your practice footfalls and then the revenues. And then you can use additional revenues or capacity that you might create to render pro bono service or poorly insured service to medicals, to patients who don't have adequate medical cover, or to do charitable work. And you can always embrace AI innovation at a pace that you can control, while at the same time keeping your ethical and POPIA standards high and prioritizing your patient trust and improving the experience. It's much easier to engage with an AI-enabled practice than it is with one that is not so enabled. So a standard joke that I use, because my general practitioner, I won't name him here in Cape Town, is very old school. I used to call him the manila folder man, because he still writes handwritten notes in a manila folder. At one point, it was not possible to contact him except via the telephone. At one point, he could not issue a digital prescription or request an online blood test or send a referral to a radiology practice or check on old notes or anything. He's learning slowly, but I hope that through this lecture, you've learned some interesting points And these strategies using artificial intelligence are here to stay. You need to understand them. You need to some extent, master them, make them part of your daily practice. And this will enhance the quality of care and the success of your practice in this very modern and technology-driven world. Another reference. And finally, I've given you a whole lot of references which you can study privately. And we'll leave. So when you download this, you'll be able to click on the links and study the references. And although I'm unfortunately ill at the moment and couldn't come to join you at GP Expo, there will be opportunity to ask questions in the Q&A. Others in the audience may answer them. And Joey will be there with Lindy to try and point you in the right direction. And if not, they can send them to me by email and I can answer them afterwards. So thank you very much for your time and attention. I hope you've learned something. I hope you've enjoyed something. And I hope that we've empowered you to understand that AI is here to stay and that you can have a much better life practice and happier patients if you embrace it and use it and not remain shackled to the past. Thank you very much.
So if you listen carefully, there's some nuances in the way he described it, right? So when I spoke about incentivizing perverse incentives and using touting and canvassing in your marketing, it's specifically related to medical services. So in the example I used, you can't say book 4 sessions, get a 5th one free, because if the person only needs 3 sessions, you are inadvertently, you could be encouraging them to over-service. But the example he used is you're incentivizing people to use a specific platform. In the same way, you could say that a cash patient, you charge a lower rate because that's better for you cash flow-wise than a medical aid patient. That doesn't incentivize them to come to you more often. It just incentivizes them to use a different payment method. So what he's talking about there is incentivizing people to use the AI-driven platforms because that it is more efficient and so that you get better adoption. Also, when it comes to providing like a free blood test or whatever, there's a difference between providing the incentive upfront and use it in your advertising and saying that if you come to us, if you stick with us for 5 years, we'll give you X, Y, Z, and rewarding people anyway, rewarding people for their loyalty anyway. So if they are a patient of yours anyway, that you're not encouraging perverse incentives. They are already your patient and you are just thanking them for their loyalty. That's a completely different scenario. Does that make sense? Okay. Any questions on the AI tools that he mentioned? Anything like that? No? Okay. So we'll carry on. Joey?
Any questions? If anyone has any questions afterwards, you can definitely just send us an email or make contact with us. One of the questions that we did have at one of the previous conferences that Dr. Peter did was, if 2 people were to put the same question, the exact same question into AI, would you get the same response? You will not get the same response. Because your AI, you've been telling your AI what you've been inputting it with information, but your colleague have inputted different information, so it's learning from you. So you are going to get 2 totally different responses from AI. It will be different because it's been you are teaching AI. So when you ask your questions to AI, you have to make it very specific. Ask in detail. So Dr. Peter actually showed us one day when he started with his presentation that he actually had a fight with ChatGPT for about half an hour. We got these WhatsApps from him and he said, this is the fight I'm having with ChatGPT. And he would say to ChatGPT, you are lying to me. And ChatGPT would apologize profusely. And then try again. And he would go back and say, but these references are wrong. So Dr. Peter started training ChatGPT. And eventually he started getting references that were correct because he had to train it. So me as an Afrikaans person, I have to now train ChatGPT to speak Afrikaans. Because yes, there are language barriers. So I have to start putting in Afrikaans questions so that I can start training it to think in Afrikaans. And last week I actually asked, go do this, this is such a fun one. Go ask ChatGPT to say to it like, we've now been having these conversations over months. Please tell me who you think I am. So ChatGPT gave me a beautiful answer about who I am. And it was quite correct. I must say it picked up on what I had inputted. Then my assistant said to me, ask it to roast you. So I asked ChatGPT to roast me. Oh my goodness. He was absolutely spot on with who I am and how I work. And it actually said to me, now roast me back. And I was like, oh my goodness, this is so funny. So when you use your ChatGPT, ask it questions. I go in and I say, hi ChatGPT, how are you today? Be friendly. You will get more results out of your ChatGPT when you are friendly, when you say thank you. When you are rude to it, it actually just ignores you, gives you very short answers. So ChatGPT can be a lot of fun in your business, in your practice. So use it. It will change your word. But check references. Make sure that it is consistent with what you are doing in your practice and that it is correct. So anything else from your side?
I just wanted to add to that. You shouldn't only ask ChatGPT questions. You should actually also ask it to ask you questions. So and when we talk about prompts, if you want to learn how to use AI effectively, you can do something called a prompt engineering course. And you don't have to do a deep dive, like a short course on prompt engineering. It just means how to prompt AI correctly. And one of the things is that if you, for example, want to come up with a social media campaign, but you're not sure how to, like what questions to ask or what to tell ChatGPT you want, if you ask the tool, I need to do X, Y, and Z, ask me 10 questions that you would like me to answer that will help you to help me best. And then it will give you 10 questions like, what is your patient demographics, whatever. And you answer ChatGPT and then say, now based on that information, I want you to do the thing that you need to do. So that's also a good way. And another thing is that exactly as Joey said, that the ChatGPT actually learns from your personality and your tone. So that gentleman over there was saying that he uses AI to put his ideas in and to just help him word things better. One of the ways you also want what you produce to sound like you. So if I speak in a specific tone, even when I write in my newsletters and stuff, ChatGPT is going to give me maybe something that's a more formal tone, which doesn't sound like me. So what I can do is I can upload something I've written before and say to ChatGPT, this is something I've written. I want you to rewrite it, but I'm going to attach another thing I've written before. I want you to rewrite this in my tone and just improve the vocabulary, the grammar and stuff. But I want it to still sound like me. So that's also another way that you can use it. Somebody had a question? Yes?
I just want to make a comment. Sometimes, I use the ones to write articles, and sometimes you can let ChatGPT give you the article, and then ask it to rewrite it again in another way. And you can get them to rewrite it in so many different ways, and then you choose the best way out of. You can combine all the articles that they've written and take the best out of that, and that will help you also get your thought processes, the different headings, and so on. Another comment that I was on an online discussion yesterday about wellness. And so you have to be very aware on these chatbots and what the AI can reply to. You can't use it blindly, because sometimes the AI does mirroring. So when you say, I feel suicidal, and ChatGPT says, I see that you feel suicidal. And then you say, I want to die. And the ChatGPT might reply, then go die. Okay, so you have to be very, very aware of what they give you and what they're telling your patients. You need to actually check on that, because you just rely on them to say the right thing that you actually want them to say.
Absolutely. Thank you so much.